Hi there. My name is Megan. I'm a student nurse. I am going to be asking you a few questions, if that's all right.
Yes.
Alrighty. So, can you please state your name for me, just to make sure everything's all put together?
My name is Maria Gaboni. I was born on May 31st, 2001.
Perfect. All right. So, how are you feeling today, Maria?
I'm feeling good.
Good. All right, and just to let you know, anything you say is confidential. It's just going to stay between us and your medical team. So, just to let you know, you do have that privacy. All right, so how do you feel about your overall health currently?
I feel good about my overall health.
Good. Do you have any concerns that are coming up?
No, none.
Excellent. Now, can you tell me, thinking back on like your childhood illnesses, did you have a history of like measles, mumps, chicken pox, strep throat, stuff like that?
When I was little, I was vaccinated for the chicken pox, measles, and mumps and all that. But when I was younger, I did have strep throat once.
Excellent. And no complications from that?
No.
Excellent. Alrighty. Have you had any like serious illnesses in the past few years, such as like scarlet fever or anything severe like that?
No.
Excellent. All right. Now, have you had any broken bones, auto accidents, very concerning wounds, head injuries, loss of consciousness, anything like that?
Back in my junior year of high school, I did break my wrist. I did break it, and then I got a splint or cast put on, and I wore that for about 6 to 8 weeks, and then it was healed and didn't have any issues after that.
Excellent. No history of burns or anything like that? Excellent. Good to hear. Alrighty. And then have you had any issues with like asthma or depression, diabetes, hypertension, heart disease, things like that?
No.
Alright. No cancer, no seizure disorders,
No.
and no sickle cell anemia, correct?
No.
Excellent. And then is there any history like in the family of diabetes or hypertension?
Yes, my grandma does have hypertension.
Okay. So you just want to make sure you're getting when we check your vitals, we make sure we check those and make sure that you're in the correct ranges, no warning signs for that. Have you ever been hospitalized before?
No.
No? Excellent. Good to hear. Have you had any surgeries recently?
Yes, I did get my wisdom teeth out back in December of 2020, so about a year ago, almost a year.
Okay, and that went well for you?
Yes.
Recovery time wasn't too bad?
Mm-hmm.
Excellent, all right. Yeah, a lot of people forget about that one, so it's good you remembered. Have you ever been pregnant?
No.
Alrighty, good. Wait on that one. Immunizations, are you up to date with your vaccines, like the flu vaccine, Tdap, the chicken pox? You did mention that before. Have you had any issues with like HPV, hepatitis?
Nope, I am all up to date with my immunizations, and I did get my flu vaccine just in like the end of September.
Excellent, good to hear. Do you remember the last time you had like a physical done, or like if you've had any vision checks, hearing checks, stuff like that?
Yes, I had, my last physical was in June 2021. My last dental was probably about 2-3 years ago, and same with my vision. It was probably about 2 years ago, I think.
All right. And then have you recently had any blood work done? This would be things like just a few, like your iron checks, stuff like that?
No.
Okay. And then do you have any allergies that we should be aware of, just like medications, seasonal allergies?
No.
Perfect. And then are you on any current medications? This includes over the counter. So anything with Motrin, Tylenol, anything like that?
Yes, I do take birth control, and I think the brand is like Janelle or something. I do take a over-the-counter multivitamin.
Excellent. All right. And then, do you take those like once a day?
Yes.
Perfect. Alrighty. And then, are there any spiritual practices that we should be aware of for your medical care? Is there anything you want to like avoid with like foods or?
Nope, I don't have no preferences.
Perfect. Alrighty. Is there any recent weight loss or gain, like fatigue, anything that's really concerning with your weight, like fluctuating?
Nope.
Excellent, good to hear. Have you had any history of skin disease? This includes hives or like melanoma, any changes in your skin color, pigmentation?
Nope.
Good. Any new moles or anything coming up that are concerning?
Nope.
Have you had any like recent hair loss or change in texture? Have your nails changed shape at all?
Nope.
All right, perfect. And then do you use sunscreen in the summer months?
Yes.
Excellent. Make sure you maintain that skin. Don't want you getting any melanoma there. Have you had any frequent or severe headaches, head injuries, like concussions, any vertigo?
Nope.
Perfect. Excuse me. Do you have anything with your eyes, like difficulty with vision, double vision, redness or swelling?
I do wear prescription contacts, lenses, and I do have glasses, but I have no complications with them. So.
Excellent, good to hear. And then, have you had any issues with your ears? I mean, a lot of kids have like their tubes put in their ears or anything, drainage issues,
No.
ear infections. Good. All right. Do you usually are you a frequent person who gets like frequent colds, or is there a lot of sinus pain or like built up with the seasons or anything?
Nope.
Good. No frequent nosebleeds. Any changes in your sense of smell?
Nope.
Perfect. And then have you had any like recent mouth pain, or is there a frequency of like sore throats? No gums bleeding, no toothaches. Has there been any lesions on your mouth or tongue?
Nope.
Okay, good. No difficulty like eating or swallowing your food or anything?
Nope.
Perfect. Have you had any pain or like a limitation of movement, or has there been like swelling in your neck anywhere?
Nope.
All right. No enlarged like spots on your neck?
Nope.
Good to know. All right. Has there been any pain or new lumps found within like your breasts? Are you giving yourself like monthly breast checks,
Yes.
examinations? Good. And then is there any history of like breast disease in your family or anything?
Nope.
Good. Make sure you keep it that way with those self-examinations. Is there any tenderness or like lumps or swellings like in your armpits or like your armpit area at all?
Nope.
Perfect. We're gonna want to check that for like your lymph nodes to make sure you stay healthy in that area. Do you have any issues like lung disease or asthma or like emphysema with your breathing? Any family history of asthma?
No.
Perfect. There's no chest pain, you don't feel like you're wheezing or like it's hard to catch your breath or anything?
Nope.
Excellent, that's perfect. Now, have you had like any chest pain recently, pressure, tightness, you feel like it's hard to breathe, like your chest's heavy, anything like that?
No.
Perfect, I like all these no's. Have you had any like swelling in your legs or discoloration in your hands and feet? Anything that's been concerning like that?
No, not at all.
No, perfect. All right. Has your appetite changed at all recently?
No.
No? All right, you're good with your food. You're not worried about heartburn or any indigestion. There's no abdominal pain at all. And then have you recently experienced any like nausea or vomiting after you've been eating?
No.
All right. Good. No constipation, diarrhea, all that fun stuff. And then with urination, there's no like burning when you pee, or is there any family history of like kidney disease or anything like that?
No.
Perfect. And then you don't have any pain in like your groin area or in your lower back at all?
No.
Perfect. With menstrual history, are you doing well with that?
Yes.
Regular periods?
Yep.
Excellent. No excessive cramping or anything like that to worry about?
No.
Good. Any concerning discharge, like discolored or anything like that?
No.
Perfect. Alrighty. And then do you feel any like pain, stiffness, or swelling in like your muscles anywhere? No back problems, no knees, we're good? Excellent. How's your exercise habits?
Good. I am on the volleyball team, and so I'm exercising a lot, and I do go to the gym in my free time.
Excellent. I love that. Alrighty. And then you said there was no history of seizure disorders in your family, correct?
No.
Good. And then you don't have any problems with like randomly fainting or any weakness or coordination problems. Is there any history of like depression or hallucinations at all?
No.
Excellent. And then is there anywhere on your body where there's like excessive bruising or lymph node swelling or any exposure to different toxins throughout your day?
No.
Good. I know playing volleyball you can get quite a few bruises, but just to check. And you said there was no history of diabetes in your family?
No.
Good. Thyroid disease at all? Anything to worry about there?
Yes, my grandma does have hypothyroidism.
Okay, so that's another thing. You just want to make sure you check with your doctor and make sure that that's maintained and you're checked as well. Alrighty, and then just a few more questions left. For your sleep patterns, do you feel like you're getting enough sleep? Do you take any naps throughout your day or anything?
No, I usually just try to go to bed on a decent time and try to get 8 to 9 hours of sleep each night.
Good, excellent. And then you said you play volleyball, so do you feel like how are you dealing with your stress related? Because I'm sure school and volleyball is very stressful for you.
I actually do like to get to the gym as a stress reliever, and just honestly relaxing, taking some time, maybe a walk is nice to help relieve any stress.
Excellent, yeah, for sure. Can you describe for me what you would eat in a typical day? Do you have like cereal in the morning or like oatmeal or something like that?
Yeah, normally in the morning I'll eat like a bowl of cereal, or sometimes I'll eat like a bagel or something. And then for lunch I would kind of have more something like a little sandwich or some fruit, and then I would eat like dinner, and that includes various things, sometimes mostly pasta, or I'll eat like a protein and vegetables.
Awesome. Sounds very nutritious. Good work. Do you have a good support system? It sounds like you're really big on your family. Are you really close with them?
Yes.
Good. That's important. And then with your personal habits, do you have any tobacco use or alcohol usage?
Nope.
Excellent. All right. My work here is done. Thank you so much.
Thank you.
Have a wonderful rest of your day.
Thank you, you too.
Oh, are you kidding me?